evening, everyone. If you can, please let us know who's joining us in the question and answer section. That'll get you used to the functionalities of Zoom. If you're joining us live on Facebook, please add your name to the comment section and let us know who you are and where you're from in the question and answer section, and then we'll get started real soon.
Thank you so much for joining us. We're so glad that you could join us for our first in the series of Health Equity Webinar Facebook Live sessions. We're asking people to speak up, step up, and level up. Level up when it comes to addressing racial inequity, wherever it may be, whether it's in the economy, in the educational system, and particularly what we will be addressing is when racial equity shows up, or it has been showing up in terms of health.
So good evening, everyone. I am Vanessa Smith. I'm the Executive Director here at Southside Health Center, and I welcome you all to our first, as Creola said, a first in our virtual town hall series. Tonight we have Sister Ya Simpson. She is a community epidemiologist and founder and CEO of TAX. She will explain what TAX is. And then we also have Maximilian Boykin. He is a policy and organizing manager from Black AIDS Institute. And tonight we're talking about the two viruses impacting the African American community. One is, of course, this new pandemic that we're experiencing, COVID-19, and then the other is HIV and AIDS. And we're going to discuss the intersectionality of those two illnesses and how it is impacting the African American community. And certainly at the end of this webinar series, hopefully you will be further engaged in our advocacy efforts to address this crisis and this issue facing the Chicago Black community. And so I'm going to have Creola Hampton, who is my co-host for this evening. She's going to be facilitating our discussion moving forward. And again, we are on Facebook Live as well as Zoom. And I appreciate it if you have any questions or comments to put them in the question and answer box below or in the top of your screen, however your screen is situated. And I'm going to turn it over to Ms. Hampton.
Good evening, everyone in Chicagoland and throughout the state and wherever you may happen to be this evening. Thank you so much for joining us for tonight's premiere, the first in the series of Facebook Live sessions that are going to take place, being presented by Southside Health Center on health equity and its impact on the African American community. And in as much as we will be talking about things that are being recognized nationwide, we're going to bring and narrow in our discussion specifically with regards to what's going on in African American communities in the state of Illinois and then in Chicago specifically. And a lot of this you may have heard before. We're asking you to share, tag, tweet, and other social media in order to get people to hear and involved, because whereas we're not only going to be talking about numbers and things you've heard before, we're going to be talking to you about advocacy and action steps, actions that you can do in order to address the inequity that is continuing to challenge the African American community. And again, as Ms. Smith says, we're going to be talking about tonight, we're going to talk about the two viruses that our communities are facing now. And that is going to be COVID-19 and HIV and AIDS. And why are those two viruses so inequitably prevalent in the African American communities, and what we can do to address it? Again, my name is Creola Kizard Hampton. I am president and founder of Greater Works, Inc. It is an integrated communications company, and so proud and graced to serve in terms of communications and public affairs for Southside Help Center. I appreciate your tuning in today. So I'm going to get right into some of these numbers. Some of these numbers you've heard, a lot of them some of them you may be able, some of the professionals and some of the people who have been watching television and looking at social media know some of these rates by heart. The thing is to keep in mind is when we're talking about Illinois, realize that African Americans only comprise 14% of the population in the state of Illinois. 14% in the state of Illinois. That's it, that's all. In Chicago, African Americans comprise 30% of the population. So keep those numbers in mind. You know, how many of us are there? You know, we know the majority of people in Chicago that are Black people live on the south and west sides of the city. And we know the majority of the people in the state of Illinois who live in Black communities are in Chicago. So keep that in mind. Illinois rates for COVID. Right now, nearly 3,000 people have succumbed to the COVID-19 virus. And even though you may be hearing now that more Latinos are testing positive for COVID, still 42% of the people who have died from COVID are Black people, those in the African American community. And even though the statistics are showing now that more Latinos have been testing for the virus, it is about the number that's being tested. How many Black people are being tested? When we look at the number of people who have contracted the illness, and that again is in the state of Illinois. And we're going to talk a little bit more, and Sister Ya is going to even lead us into, when we talk about numbers, what the numbers, not just what they mean at large, but what they mean to us, Black people. When I say us, I'm going to say that. In Chicago, still, though 30% of the population in Chicago is African American, 72% of the deaths from COVID in Chicago are African Americans, 72%. So let's talk a little bit about HIV and AIDS too. Again, African Americans, only 14% of the population in the state of Illinois, but 52% of people living with AIDS in the state of Illinois are Black people. Again, 62% of new cases, that means are Black people. Again, so let's talk about HIV and AIDS in Chicago. In Chicago, again, 30% of the population in Chicago are Black people, but again, 52% of cases of people who are living with HIV and AIDS are Black people. And in Chicago, 62% again of people who have newly been diagnosed with HIV and AIDS are Black people. Is there something wrong with our communities? Is there something wrong physically with us? Do we have a higher propensity for viruses like HIV and AIDS and COVID than any other people? Why are the rates so much higher in our communities And why do we have the rates for even contracting the viruses? And then why are the rates for death so much higher in the Black community than in other communities that are contracting the disease? So those are the questions that we need to ask once you know the numbers. And tonight we're going to have some of the answers and what you can do about it. Please continue throughout this session to send us your questions and your comments, and we're going to even post a poll that you can answer to help us even get some more facts and information about the disease, its impact on our community, and what we can do to try to help turn it around. So the first person that we have again that's going to speak is Sister Ya, and I'm going to give you, even as she introduces herself, I'm going to tell you a little bit more about Sister Ya. She is the founder of TACS, the Association of Clinical Trial Service. And it is a 501c3 community-based nonprofit organization designed to provide prevention and intervention education, as well as awareness for people impacted and infected by health ailments. As a Black woman and a veteran organization, she is interested in collaborating with other organizations on issues surrounding health equity and social justice. Speak, Sister Ya, speak. Oh, I'm sorry. Is your mic on?
I had put myself on mute, but we're all here. Hey, everybody. Hi, my name is Sister Ya, your favorite community epidemiologist. I want to first of all thank Vanessa Smith from Southside Health Center, and as well Miss Hampton, Miss Creola Hampton. It rolls off the tongue, doesn't it? And we want to, of course, in our welcoming back our brother we haven't seen in around, Mr. Boykin himself is in the house. So we want to do this. This is going live as usual. We are dealing with a new reality, you all. We are now having to meet in virtual reality. And so all of us are getting used to this paradigm and getting used to this form. So thank you all for doing this. So let's get right down to it because we don't have long. We only have an hour for this. And I want to hear more from our audience members. But as Ms. Creola, as really, she's already done the most as far as giving you all statistics and data. As an epidemiologist, that's what I do. I do talk about how the impact of data is on us as Black people. So I want to just go ahead and share my slides with you all, and so we can just go a little bit into what is it that we're working with. Okay, I should be able to share. And so you all should be able to see my slides, right? Everybody can see where it says tax?
Yes.
All right. So what we're dealing with here is understanding about COVID-19, and we're definitely understanding about what it means to be involved with HIV and other viruses. So I just want to give a shout out to all the people that I have been associated with. Definitely, I'm a part of the Men and Women's Prison Ministry, which now is called TRS, Translating Reentry Services, and I'm the vice president with them. And so just making sure, just saying hi to NBAC and all the people that I am closely working with, including the Illinois Black Pandemic Citizens Task Force. So we're going to talk a little bit. You'll hear Max is going to talk about health equity, but I want you all to see, and I hope you can see this clearly, that the bicycles and how we talk about health equity. And why is this important? Because we are dealing with why we're not being treated fairly in this country. So you see all the bikes at the top, they're all the same, but we don't need all the same bikes. We need different bikes. We're not immigrants. Let's be clear about this. We were brought here, and some of us were here, including the founder of Chicago, who was not an enslaved African, but he was a Haitian who was actually got our name Chicago. So Africans have been in this country before and after Columbus. But the point is that we're not going to be treated the same as other people. So we need the bikes, as you can see at the bottom, that is the equity. We need the bikes that fit us. Some of them have to be tall, some of them have to be small, but they may even be 3 wheels. But the bottom line, it has to fit us. So that's what we're talking about with health equity. I want to give a shout out to Black Star right quick because they did something real important. They actually published one of my articles in which this is why we're having this conversation, is among many people are having this conversation, and that is about the two pandemics. Now, you all heard COVID-19 and everybody, woo, HIV was a pandemic as well. I don't know if people knew that, but a pandemic, as an epidemiologist, I'll tell you the definition. That means that it is an infectious disease or illness that is around the world. Pan meaning around the world. When it's only located in a certain region, let's just say, for example, that this was only to the Middle Eastern countries, it would be called MERS, if you will. That is called an epidemic because it's only in one region. If it was only germane to that in China and never went anywhere else, it would be called an epidemic. But when it's a pandemic is when you start pulling in 184 different countries and they all have a case of it. That is called a pandemic because it is around the world. So as we talk about this pandemic, we have to do several steps. One is you look at it globally. Yes, that is real. Then you have to start paring down to which country you live in. And then you, in our country, you want to pare down to what state you live in and obviously what city. Why is that important? Because that's what Creola was giving you all numbers on. We are focusing on what's happening here in Chicago and in Illinois. So our data is relevant to that of Chicago and Illinois. So I am not going to really get a lot into the specific data, specifically around COVID-19, only because you all probably know more of that than I do. But in this article that I wrote with Black Star, I just want to show you all clearly that some of the things that we're dealing with is that we have underlying preconditions. So things like asthma, heart disease, diabetes, COPD, complications and obesity, of course, all of the things, as well as things like current and post-traumatic stress. Did you hear me? I said current and post-traumatic stress. We are dealing with violence on epic levels that we have not really wanted to talk about, but have to, all of us are dealing with it here in Chicago for sure. And in those things we talk about, why is it that this is impacting the Black community? We call this social determinants of health. Now, social determinants is exactly how it sounds. It's a social construct that determines how your health outcome is going to be. And health is not one thing as in itself. If we was to think about the body, right, we would say the head is there, and that's what you all see is my head mostly, right? But there's a whole body that's up underneath this. There's an entire arms, legs, and everything to go with it, and they all have to come together and do what? Function as one. Well, unfortunately, you all, our systems isn't coming together and functioning as one. That's not what's happening for Black people, and is not what we can really put our minds around, because we have to deal with a whole host of social determinants that's having an impact on our health. What I really wanted to bring to fruition here is that even with all our politicians, even with all of our we have everybody that's in office, a Black woman, new Black woman in office. We have all of those things, and that's great, but that has not changed, including our president being Black at one time when we call a real president. You know, I ain't gonna go there, but the last real president we have was a Black man. But even with all of that, how has that changed our health conditions? In fact, you all, it got worse. So we have to deal with these numbers, and I'm only gonna deal with a little bit as it relates to the rates, because Creola specifically said, you know, a lot of people they hear numbers, but they're not understanding what they really mean. And one that I'm gonna focus on only because you can find this on the Chicago Department of Public Health website. You can go, of course, Chicago/coronavirus.org. It's very simple, Google it, you'll come up. But why is this important, you all? Because I'm focusing here on the death rates in the city of Chicago. So they saying that the last time I just looked at this today, so this is the last one I've seen that was put on the website, but we've had death cases. So people who have died from what? Coronavirus, or COVID-19 as we're calling it. And it's actually SARS version 2, but that's neither here nor there. So people have died 1,552. So we know that that's a 100% of all the people who have, they've known to have count that they said actually had this virus. Now we know about that. So from there, they could do a breakdown based on the age, based on the male, female. As you can see, I hope you can see this slide a little bit better. I'll blow it up just to make sure. But as you can see that there's mostly, there's mostly the ages that's there, but there's mostly more males that are dying from COVID-19 as compared to females. That's one of the issues that we're having to think about, but more importantly, we need to really think about, and that's interesting, that's coming up, we need to think about race, and this is why we're on here. As we look at the people who have died, 738 Black people have died from COVID-19. That's 48% of the cases of death cases. The rate for that is, we look at it based on what the population is, which is Black in this case, and then how many people actually had it, the number. So that's where they get the percentage as a rate. The number of people who have this, the number of people who died, specifically 1,552, and then you look at how many of those people were, in our case, we're going to say Black, right? 738. And then when you look at white, it's 296, and Latino at that time had a different number, but I'm sure it's going to be updated. It was 405. So the rate for us as Black at this time was 48% of people who have contracted COVID-19, died for COVID-19, were Black people. And that's what we mean by a rate. And so rate is just an idea of how to give the population size and what we would call the disease or illness itself. And then of course you do some division, multiplication, and you come up with a percentage. Now there is some other things I could have done, but I'm gonna save that for another day about case fatality rates in itself. But this is the death rates based on everybody who has died. And the impact, no matter what we say, no matter what you, the takeaway home message is Black people are suffering from deaths at a higher rate than that of other people. So whites, not the same rate, they're only 19.3. At that time, Latinos are 3.7, but I'm hearing that their rates are increasing. But the bottom line is Black people are at 48. Excuse me, Latinos was 26, excuse me. But Black people are at 48.1%. That's a high rate as compared to others. So that's why we're dealing with this. So I respect the fact that we talk about HIV virus, we talk about COVID-19 virus, which is SARS versions 2 is the virus. Now we're talking about, in my opinion, and as I stated earlier, I'm dealing with this a little differently, as in I'm calling it a pandemic racism. That is what I see this as being, pandemic racism. So for me, it's a different understanding of this, as in we have to think about the pandemic racism as it relates to us being Black people in this country. So that is one of the reasons why our numbers are so high. It's not just social determinants of health, it's actually also pandemic racism. And that term was given to me by one of my pastor friends, Pastor Anthony Williams, and he said he coined it from someone else, but the bottom line is that is the undercurrent for what we're dealing with as a pandemic in this United States, and specifically, I will say, around the world. I'm sure you heard about Africans being treated differently. I'm sure you heard about in different parts of different countries where people were talking about Africans and Black people as though they were marginalized. And it's no different in this country, because I know you heard about what happened down south, and I'm not gonna go there because it's a hurtful thing. But the bottom line is that pandemic racism is the undercurrent, if you will, for why Black people's rates are so high. It is one of the main reasons for us to have to deal with what we're dealing with in this country, racism, and I'm calling it out. And I'm saying it is a virus. Racism is a virus because even Black people can be racist against other Blacks. It's so interwoven into this country. People want to act like just because we had a Black president, a Black mayor, for that matter, new Black women in new Black positions, we still are faring and faring out worse as compared to other races and ethnicities. We've got to get better on that. So one of the things I'm going to leave you with in talking about this is that we need to start thinking about dismantling the healthcare system. I didn't say dismantling racism, did I? I said dismantling the healthcare system because this system isn't working for us. We're not being healed. If you look at the word health, what's the root word? I'm showing it to you right now. H-E-A-L. Heal. We're not getting healed. We're not getting the healing that we need in this country. So when an epidemic or a pandemic like this virus comes around, we can actually survive and improve our health and do better. We're not getting that. And so because we're not getting that, the human impact people also said, we got to do a call for a moral revival. And I love that. The reason that we're talking about a moral revival is because they know they've been morally wrong in this country. And I'm going to focus on this country, specifically in the state of Illinois and definitely in Chicago. We are not treated the same and we don't have the best health outcomes because of the pandemic racism, the undercurrent. That's what's going on with us. And if we're not into being healed, then what are we here to talk about? Heal. If you don't have your health, you don't have your life, you don't have anything. And so we want to make sure that we're working on getting that health and healing correct. So I am going to be available for questions. Again, the whole point is I hope people have been able to see my article for Black Star about pandemic racism. And my next article is actually going to be on dismantling the healthcare system. Some of the solutions we'll get into, and I think Ms. Creola is going to ask us for what solutions are at the end. But so I'm not going to go into that right now. But my whole point here is to tell you that these two viruses is undercurrent is pandemic racism, and that's the true virus. And if we can get around that, if we can cure that, and we in this country we're gonna have to treat it because I don't see the cure coming no time soon. But if we can start treating the racism that we're experiencing here in this United States, in this country, then we can start talking about improving our health care. Thank you all, and I hope that was insightful, and we'll get to questions and answers when we finish.
That was absolutely insightful, absolutely very pointed. I hope everybody understood the information. Again, we're going to post a survey so that we can get some answers from you. And one of the questions will be, there you go, have you been able to get a COVID test? And have you been able to get a free HIV test or screening? So we want to talk about, you know, the availability of testing in our communities and see to what degree, at least those who are watching have been on. It'd be great to see citywide, but just to get some kind of sample as we talk about those who are watching, whether you're in the state of Illinois or whether you're particularly in the city of Chicago, have you been able to get a test? And again, the more testing we see, it looks like the more we're seeing what looks like a spike in the disease. But again, is the reason because there's more testing, or is the reason because there's a higher spread? And the next person we're going to have up, we're going to talk more about, again, not only COVID and HIV, and then we're talking to a person right now who puts the action in advocacy. And I want you to listen, and I want you to consider again.
So before we move on to the next presenter, I just wanted to share the polling results. So, 100% of the people that participated in the poll, wow, they could not get a COVID test, right? Mm-hmm. That really speaks volume to, you know, what's happening in the Black community. Do you know where to get an HIV test or and screening? Yes, they know. 4 said no, they don't know where to get a test or a screening. So that's interesting as well. So I just wanted to share those results. Thank you all for participating in the poll.
Thank you again. And again, what we're going to be doing in post is please share and like the Southside Help Center Facebook page, because we're going to be providing information so that you can see where you can get a free HIV test and information on where you can even get COVID testing. Max is going to share with us, and we're going to even get some numbers to help us understand who you're going to call when it comes to help addressing what's going on to treat the pandemic racism. Maximilian Boykin, he is the National Policy and Organizing Manager for Black AIDS Institute. He has served with BYP 100 Chicago chapter. He has also been the lead for community engagement for AIDS Foundation Chicago. He is based right now in Atlanta, but Max has traveled the entire country in terms of advocacy, community organizing, and policy with regard to inequities of Black healthcare. Founded in May 1999, the Black AIDS Institute is the only premier, uniquely, unapologetically Black national think tank in America, with 2 decades of work dedicated to ending the Black HIV epidemic. And it is led by people who represent the issues we serve. Black AIDS Institute has the capacity for building, mobilizing, and doing advocacy and policy from Black leaders and communities across the country to provide high quality, direct services and linkage to care for Black people. Black AIDS Institute is deeply committed to exposing the systems and roots of oppression used around the world and in the United States in particularly to marginalize Black people as a whole. Speak to us, Max, on advocating for health and racial equity.
All right.
There you go.
Myself, but thank you so very much for that introduction, Creola. And thank you all so very much for having me on this town hall today. And always good to talk to my people in Chicago. Thank y'all for joining us. Today I'll be talking about advocating for health and racial equity. As Sister Ya most best put understanding is when we're talking about equity, we also have to change the way in which we are talking about access to resources. And gone are we were with the use of the word equality, which is a word that we have used for many years, but understanding that equality, the actual communities that are most impacted by something are actually getting the resources that they need. And in order to do that, we must redistribute resources. And for us to use up the word health equity, we must also talk about redistributing resources. And if we are not redistributing resources, we should never use the word equity in the foot. For our ability to advocate to make the change that we want to see. The only way in which we do that is through power. And that is, I took actually one of the definitions is from a wonderful organization in Chicago that the Assad Daughters organization uses. Power is the ability to control or make things happen. Power is not necessarily a good or bad thing. Power is a thing that we see no matter what. And also, when we think about this, and as a collective that I'm a part of, HIV Racial Justice Now, power is the manifestation of our collective visions into coordinated action. It is when we bring everything together in order to actually, in bringing our voices together, bringing our bodies together in safe ways as possible in this time, to make sure that we are making, to build the things that we want to see change. And I was also of the Clatter for Health Equity of Cook County, and I had the fortunate ability to be a part of Robert Wood Johnson's Culture of Health Leaders program, where to go a step above creating health equity and racial equity, we must actually define what a culture of health is. And some of the ways in which we did that was which we must value people. We must also make sure, again, that we are equitably actually making sure that resources are given to the communities that need it the most, as Sister Ya brought up the bikes. We must also make sure that our elected officials represent us, and that representation is done in a way that actually represents the communities that need it the most, and those resources are made, and if our representation is right, it makes it easier for us to spread resources equitably. And then we also must collaborate. If we're not working together, we can't build and we can't move. And then we also must be accountable to one another. Anytime that our governments, as we see, are not accountable to the people, they will continue to move in a way that does not actually give us the things that we need. And then we actually must take the actions in order to make that happen. And one of the ways in which we make those things happen is through coordinated advocacy. Advocacy is defined as a public support for a recommendation or a particular cause or policy. There are many kinds of advocacy and different theories and frameworks of advocacy. Self-advocacy, advocating for oneself. Systems advocacy is when you are changing and trying to move said system to actually moving the things that we want to see within community. And lastly, also we have legislative advocacy. There's even more advocacy, but I also want to, anytime that we are talking with our legislators, we are asking for systems change. You know, to understand how in which sometimes that can be very difficult. But we also want to make sure that those systems are being changed by our legislative advocacy and our government systems, and especially during pandemics or epidemics, be it HIV or COVID-19, we are understanding that it is our government's job to deal with such things. We pay our taxes and we pay their salaries to make sure that they are doing what they are supposed to do for our communities.
Yes.
And we've had a chance to learn from some of the best advocates around. If you look, we have many folks up here that I have: Mario Cooper, Ron Johnson, Gary Cooper, Marlon Riggs, Exis Hempfield, Barbara Smith, some folks that of course, I had also put Ella Baker there before. But some folks I definitely want to are two folks that have connections to Chicago. Dr. Kathy Cohen at the University of Chicago, who helped write the book, which was the book really to folks talk about how HIV was disproportionately impacting Black people, making sure that data was there. And then also Phil Wilson, who founded the Black AIDS Institute 21 years ago this month. And something that he had said at the beginning of Trump administration's time was, new challenges call for an updated approach to ending the epidemic in Black community. For example, the political climate makes the fight against HIV even more challenging than in years past. The intersectionality between race and HIV is so clear. We have a president and an administration that is attacking efforts to fight HIV directly, while at the same attacking Black people along with it. Now, I want you to look at that quote and replace HIV/AIDS with COVID-19. We can say the same thing with the way in which the administration is doing, or even many other administrations. As a person who used to live in Chicago, I wish I had a governor that at least had some type of understanding of response. As a person living in Georgia now, I understand that in his response, he did not care about what Black people wanted, and actually it needed, in order to keep us safe and actually put people in more risk, opening back the state. And seeing many other governors and even the president, the current man in that office, push for us to actually continue to open up those offices, and that is the problem. So how do we advocate in this time? How do we continue to move forward? Look at that triangle: the health, literacy, political education, community mobilization. I'm gonna bring us back to that. But there's many different ways in which we can advocate. We can canvass, survey to our community. Something that I always used to do on the south side of Chicago was, ask surveying questions, have palm cards out there to get responses. Registering people to vote. This is an election year. Definitely important for us to do this. Political education, telling your story, phone banking, having community meetings, even if they are virtual today, attending a town hall like y'all did today, virtual town halls and events, having form and continue to form coalitions. I think the beginning of the Trump administration, there was many coalitions formed, and I am now also seeing even more coalitions formed in response to COVID-19. In dire situations, we also come together. We also rally, meet with our candidates, bird dogging, which was something that was successfully used against Rahm Emanuel when he was former mayor, around schooling and also around his not responding to things that some of the people were dealing with at that time with shootings of young Black people. Meeting with candidates, again, bird dogging, writing an email, and creating local policy guides are all ways in which we can advocate for the change that we want to see. It's important to tell our stories and to make it personal. What gets on the news is not always the facts and figures, but it's actually the stories that we tell, and making that personal. And practicing and offering solutions.
Yes.
When we're engaging folks. Now, I'm not going to go too much into the ending HIV epidemic plan, but I understand the Trump administration made a plan. There wasn't a plan for Black people. So what we did at the Black AIDS Institute, along with connecting with people, was we created a plan for our folks. And that was a We the People of Black plan to end HIV in America. And it was to talk about the structural issues that we were dealing with. That included dismantling anti-Black practices, investing in our Black communities, dealing with those social determinants of health, as Sister Yaw was just talking about universal healthcare access. What does it mean for everyone to have access to healthcare in this country? And we also understand that is not the end goal of it, right? And we also understand healthcare access without understanding racism also still leads to broad problems. If you look at the AMFAR data, you actually can go and look at London, and Black people are disproportionately impacted there, and they do have a national healthcare system, all right? Because they are not because of there is still racism within their system. As long as that is the place, we will not actually get to the place of how in which we want to get proper healthcare facilities for our communities. And then something that the Black AIDS Institute will always do is building the capacity and motivation of Black communities to be the change agents for ending HIV. One of the ways that we have to do that is you have to get your facts right. This piece also comes from the AMFAR data that just came out last week around COVID-19. This is really important for us to get, and how in which one of the things that we learned within that was the places that were disproportionately impacted by HIV are also the ones disproportionately impacted by the HIV epidemic. And we're like, why is that? And it's again connected to those things that Sister Yaw put out. But we also found out that any county that was majority Black had at least one COVID-19 impact. We got to have our facts right when we're talking to our people. And that's why it was so important for both Riola and Sister Yaw to give us those data points as we're thinking about it. And as we think about developing, we have to develop, in order to dismantle anti-Black practices, we have to develop local resource, anti-racist, human rights-based coalitions that are fighting back against it, such as the Black Treatment Advocacy Network, and other ones such as HIV Racial Justice Now, and others. And also get rid of those laws that are on the books. That means laws that are further criminalizing our people, getting rid of those laws that are hurting our communities. We also must provide resources and services that address the fullness riches of our community. This is dealing with those social determinants of health, ensuring that the health and supportive services and the holistic care that folks need in order to end those multiple pandemics. We also have to, as we said, healthcare is a human right, and that is something that we truly believe at the Black AIDS Institute, and it is not enough to do that. And we also know that racist data, and as long as our healthcare system also allows for racist data, we'll have racist outcomes. We have to make sure that we push back against that and build the capacity of our motivation of our Black people, right? So we took this larger thing and we took it and made it into a report. So we had something that we could write, people could always have in connection to them. That is an important thing to have in advocacy, having your data and then also having something that people can go to, Black of the Plan, and also using social media in this time, having hashtags are really important for us to be able to engage our folks. We also uplifted different stories that we are hearing across the country in order to make that happen. So we created the plan, we have the Black of the Plan. What's next? Next thing we got to do is organize. We got to bring our people together. The supreme task, as Dr. Martin Luther King said, the supreme task is to organize and unite our people so that our anger becomes the transforming force. Our folks are angry, they are sad, they are hurting from how these different pandemics and epidemics have impacted our folks. And the ways in which we change that is by bringing our folks together. And so, something else that Dr. King always said, we got to organize, organize, organize. And with that, we had to create goals for our We the People plan. And we also had to, as the first piece, that is actually the creating of the report. And that's making sure that these different jurisdictions, be it the Illinois Department of Public Health, and I've been on town halls now with Mississippi, Alabama, and Charlotte this week, to talk about ways in which we can make sure ensure and hold those governmental pieces, hold their feet to the fire and saying, what are they doing for our communities in time? Engage and empower our Black communities to be integral advocates, ensure recipients of government funding are culturally humble. As much as we would love to create a system that is separate, but we also live in the system, we pay taxes to the system. As long as we are doing that, that system should also be accountable to us. They're getting funds for us. They should actually make sure that they are being culturally humble and understanding ways in which and also making sure that we're advocating for funds to go to our communities that need it the most. And then ensure this whole rollout doesn't actually negatively impact us. One of the ways we do that is through our Black Treatment Advocacy Network. And as I saw, health literacy, important piece in political education. That's getting that background that Sister Yaw and Creole were giving us. Understanding also those political factors that change and make it possible for us to change or not change some of those things. And lastly, we got to bring everyone together to mobilize our community to make that change happen. So the ways to do that, I also I said I was a part of Cultural Health Leaders and Collaborative Health Equity, and some of the coalition building that has to happen next within our ability to make that happen. We have to work with some of the communities that sometimes aren't ours to make that happen, but also stand true in what we believe in. Stand true, and I never had to give up in any that I was dealing with was to give up resources to my community, the Black community, in order to help out another community. There is a belief in the system, and it actually comes out of the Chicago machine, was to make especially other communities of color fight one another for those resources. We actually need to fight back against that. And one of the things I was most proud about in Chicago was creating that coalition of other young people, young Black folks, along with young Latinx folks, to come together to push back against no matter what the city was trying to say about shootings of young unarmed Black folks, and also the putting young immigrant people in detention center. We were going to stand firm together and also advocate with one another for the things that we need to see. So as I say all that, we want to be able to come together, fight for the resources that we need, and the ways in which we do that. And one of those is getting the data, the facts together, making sure that you have a series and a rollout of being able to have continued community engagement. And one slide I forgot to put in is the pieces of a campaign, but continued engagement has to happen with community in order for us to have the change we want to see, because our community has to know what's going on, they have to feel what's going on, and they have to be the ones to show up, because it's not just me and the wonderful people you got on this panel. You got to have everyone to make the change that we want to see. And if you want to see more about We the People, visit blackaids.org/We the People to get more connected to our Black of the Plan. Thank you.
Thank you, Max. Do we have the other part two of the advocacy of the questions that we had, Ms. Smith, for the survey?
Yes, we do. But before we do have a question. We have a question from Artina Graves, and she was wondering, do you believe Black people are being misdiagnosed for COVID-19?
Okay, so let me get into that. Do I think that Black people are being misdiagnosed? Is that the question?
Yes.
Okay, so let me be clear. Black people are not being any more misdiagnosed than any other people. People might be being misdiagnosed because they're all taking the same test. Remember, the test does not know your race, your ethnicity, your whatever it is your heritage may be. What the test knows is supposed to say whether you have a virus. This case, this virus is SARS version 2, that you know it as COVID-19, which is the illness. But it is to test, is a PCR test, which is a very specific test for a virus. And it definitely tries to pick up that specificity and hope sensitivity in anybody. So when you tell me, do Black people get misdiagnosed? I'm going to say people may be getting misdiagnosed, but I'm also going to be very cautious about that, because if they're actually doing a PCR testing, especially if it's blood, then that's one of the most effective testing methods out. Blood testing is the most effective. There are people who are doing PCR testing through the nasal. That is the secondary. And, you know, I'm not going to get into the other types, but that is the two that I know that's being utilized. And yes, as in anybody's testing, it doesn't matter. As long as a man made it, there will be some fallacies to the test. So there may be a couple of people who are what we consider false positives or false negatives, because their antibodies or their bodies and their systems haven't yet formed to the virus itself. So let's just say you were exposed yesterday and you went to get tested today. You may not show up. It may not validate that you have this virus, but in 2 weeks from now, you're sitting there with the fever, you have the signs and symptoms. You all is more than 3. It's about 9 signs and symptoms, but I won't go into that. But the point of it is in 2 weeks, you turn up with the signs and symptoms, and all of a sudden you're like, but I tested last week. Well, your body wasn't able to produce the fight, we call it antibodies, right? So the test results were skewed because you did not know that you had been exposed so quickly. So is there some people out here that is a possibility? In fact, we know it happens. But is it the majority just because they're Black? Absolutely not. Anybody, any human. I hope that answered your question thoroughly.
Okay, thank you. Thank you. Yeah, that was the other question.
And this is from Sanford Gaylord.
Hey, Sanford, shout out.
Has COVID antibody tests, have they been considered for people living with AIDS that may have already had COVID in an attempt for them to be used for people living with AIDS that may be experiencing COVID with some challenges?
Wow, that is a insightful question. So the way I would understand that is, okay, someone with HIV, and it doesn't matter whether they progress to AIDS or not. It's about, do they have HIV, that human immunodeficiency virus? So yes, you can be it's called comorbidities. It's no different than if you were to acquire hepatitis, or there are various viruses that CMV. I don't want to get too deep on the viruses, but the point that I'm making is you can have coexisting viruses, and how that impacts your body is specific to your person. I mean, can you have the flu and HIV? Absolutely. So the flu is another virus, influenza. So yes, you can have comorbidity within viruses in your body. But you're asking specifically, does people with HIV have some type of difference in the way that they are taking on COVID? And I would have to say that's always specific to the person, because I don't know what your immune system is at. I don't know how well you have been, maintaining what they consider a level of compliance or keeping the virus down in the body. We're going to call that viral suppression for HIV. That all plays a role. So if you're not dealing with viral suppression, and then you also get, in this case, COVID-19, you can have more complications, absolutely, or you cannot. So I don't want to generalize it, but I will point to people and say comorbidities with other viruses has a more of an impact on your body to do better. So it is best to go ahead and take care of what you can take care, knowing that we cannot, at this point, HIV is not a cure, but you can treat it. But COVID is only they tell us 2 weeks, but if you have underlying health conditions, then you're absolutely correct, Sanford. It could go on longer. But let's hope that people are getting the right type of treatments and care so they don't progress to that complications. I hope that answered your question more thoroughly.
Thank you.
So, thank you. So I'm going to go ahead and let's do the advocacy poll. And then we're going to get back to some questions. Okay, so thank you so much, Max, for that very insightful advocacy presentation. We're going to encourage everybody to go out and find their alderman, their state senator, their state rep, and really, convey your concerns and issues around COVID as well as HIV. So I'm going to launch this poll, and we'll have a few minutes to respond. The first one, have you ever contacted your alderman to vote on an issue regarding the city of Chicago on your behalf? Yes or no? The second question, have you ever contacted your Illinois state representative or senator about voting on an issue? And the third question is, if we provided the information, would you call or contact your city and state representative to vote on an issue? If we provided that information to you. All right, and we've got.
And so while you're completing that, yeah, and while you're completing that, we have a specific call to action that when we said we wanted to give you information that you could use that would allow you to do a specific action, and especially as what Max has identified is in terms of how advocacy, to make it effective, is to identify specifics. So yes.
So the first question we had, 44% said yes, 56% said no, they have never contacted an alderman to vote on behalf of the issue. 56% said no about contacting their state rep and senator. And overwhelmingly, a lot of them say yes. If I had the information, I would contact our state rep and aldermen. So, you know, it's important for us to really participate in the advocacy process in order to get the needs that we need for our community. It's imperative that we do so. Otherwise, we cannot make any changes in our community and ending the AIDS epidemic.
So here is our specific ask. You say, what specifically are we asking and what specifically are we recommending that you can do? One, on a city level, we are urging you to contact your alderman. And Allison Arwady as head of Chicago Department of Public Health, specifically with this regard. You already heard the statistics. 30% of people living in the city of Chicago are Black. 62% of new cases of HIV and AIDS are Black. 55% of people living with HIV and AIDS are Black. And specific to that, we need to let you know, put you aware that the city of Chicago, Chicago Department of Public Health, had a budget of $40.4 million, $40.4 million that was allocated to the city specifically to address HIV and AIDS. And of that $40.4 million, only $1.7 million was allocated to Black organizations that are doing the work in the city of Chicago for HIV and AIDS. $1.7 million out of $40.4 million. That is what was allocated just when the funding was released and announced last October. So how can we expect for our communities and our organizations to be able to address and negate the spread of HIV and AIDS and treat it equitably if $40 million goes to the city for HIV and AIDS and $1.7 million goes to Black organizations? So we are urging you to contact your alderman, contact the head of Chicago Department of Public Health. Yes, you can even let the mayor of Chicago know. You have heard those rates. They are true. They are open to the public, those figures, even the names of the organizations that received the monies and those that did not. Only $1.7 million of $40.4 million that was allocated to the city of Chicago went to Black-led organizations. So we want you to call your alderman and we're going to provide you with information. If you don't know who your alderman is, we will help you to find out who that person is and the best way to reach them, whether it's on their Twitter or on their Facebook or on their telephones or via email. That is one crucial point. So that's the city. Okay, what's the other component on a state level? There is a law that was passed in 2005. It is called the Illinois African American HIV/AIDS Response Act, passed in 2005. Why? Again, 14% of the population in the state of Illinois are Black people, and at that time, 55% of cases of HIV and AIDS were in the Black community. 2005. Here we are, 2020, 15 years later. Still, Black people, 14% of the population in Illinois. And yet, 52% of cases of HIV and AIDS are still in the Black community. And you know what? The African American Response Act, where it originally had $10 million in it, the budget right now is zero. Can you believe it? Zero. Nothing has been allocated to that budget, from the budget to that fund as of right now. And the budget for the state of Illinois is going to be voted on before the first week in June. So we are urging you, this is an urgent appeal, for you to contact your Illinois state representative and your Illinois state senator and say to him or her, especially if they are part of the Illinois Black Caucus, which is meeting tomorrow, by the way, get some money in the Illinois African American Response Act. $20 million is what's urgently needed. Contact the governor, contact the deputy governor, contact your state and representatives and let them know you know about the Illinois African American Response Act and there is no money being allocated to it, and demand. We were going to post this information on social media. We're going to continue to send it out. Please share and spread the word. Your urgent cry for advocacy is needed now. Now you have something that you can act on and make a difference for. So let's get back to any other questions we have. And again, please continue to look to Southside Help Center on its website, on its Facebook page and other social media, and we will continue to be communicating with you. Steps that you can, not just things that you can hear about, but steps that you can take to help push and influence change for the better in terms of addressing health equity in the Black community.
So we did have another question, and Sister Ya is going to answer that. You want to state the question?
Can you repeat the question for me?
If the test, it's related to the question you had earlier. If the test cannot be inaccurate, how can there be disproportionate representation if it is true?
Okay, I'm a little bit not understanding, but I'm gonna go to the feeling of the question, which is
we can unmute Artina. Artina, do you want to respond live? I can allow you to talk.
There she is.
Yeah, Artina. Let's see. You can unmute yourself if you want to talk, ask the question, Artina. Okay, you said no. Okay.
Okay.
That's fine.
Well, I'm going to get to the gist of the question, which is really, it's a question about the testing itself. And you're questioning the numbers. You're like, is that data correct? And to be honest with you all, I have to tell you, we still have to go by what it is that we know. We know nothing is 100%. No test on the planet is 100, except for to test you when you're not breathing, and that's death. Now that one you can get, but the rest of this is always in between. So we go by what we call specificity and sensitivity. Specificity, how specific it is for the virus that is testing, and sensitive, how well is it to the core of when you got it and is actually, you know, more into the timing of when you have it. And that's why I told you, you can test one day and not have it, and then 2 weeks later you'll be testing and say you have it. That's because the test is for the body, the virus in the body. So again, how accurate is the numbers? We are never going to know 100%, but I can say that based on what they do put out. See, and I think, Max, you dealt with this a little bit. He talked about the racist data. And I am actually, as an epidemiologist, he's 100. We know, we call it, we're nice though. We go biased data. You've heard that term, right? And caller, you're saying, how accurate is this data? So we're like, well, it's a little biased. In other words, it's a little racist. It probably is leaning toward more talking about what's wrong with Black people and not talking about what's right with us and what we did better. Data in itself, 2 + 2 is always 4. Let me be clear. 2 + 2 is always 4, but for who or for against. It's about interpretation and usability, implementation of the data. So it's not that data is wrong. It's about how it's being implemented and how it's being interpreted. And that's the job, myself, people like Max, and everybody on this call, Vanessa, everybody here has to interpret what the data means in the Black community. And why is it that it seems skewed towards us? Now, I've already addressed that with the pandemic racism is skewed because this country's skewed about things. But again, Max said it right. It's racist data when the data is being led by someone's race of what's wrong with them. It's biased data when the data is being led by how come you all and this, that, and the other. When data is for you, it talks about your assets and not just your challenges. We don't have balanced data. So I'm always going to tell you data is to be used because it's an evidence-based approach. It is facts, speaking facts. But the fact is, how do people interpret that fact and use it against us? And remember, slavery used to be a law. It was considered data that our brains and bodies wasn't even human. And we know that that was wrong because we're the first humans on this planet. It was because not the data, it was how it was interpreted and used against us. So we just need to make sure how we interpret and how we utilize and what we call implement the data is what's important for testing. But you need to get tested. I am encouraging everybody on my voice, find out your status. Just like we did with HIV, you need to know about COVID-19.
So there is a question, and I'm not quite sure if she's still on the Zoom call, but Max had spoke about the disproportionate impact of HIV in areas where there's high rates of HIV as well as high rates of COVID. She wanted you to kind of restate some of that information, but I know here specifically in Chicago, like we have a community, South Shore, they have high rates of new HIV infections, but it also has very high rates of COVID. And again, to Max and Ya's statement is that, you know, there are underlying reasons for that, and that's limited access to healthcare, you know, racism, as well as stigma. You know, and we're gonna have to deal with the stigma, the aftermath of COVID stigma after this is all over. So Max, do you want to address that issue?
Yes, I want to say the communities that the community within the Black community that is the newly diagnosed for HIV versus the newly diagnosed for COVID-19 are not necessarily the same. But if you went by zip code, if you went where our folks are, you will still see high rates of COVID-19, as wrong with HIV, along with asthma, along with cancer, and all the other things. And actually, what you should, I would really challenge folks, look at the ANFAR data, then go to Healthy Chicago 2.0, the last piece that came out there, and look at the data oversets and just look at the overlapping maps of where COVID-19 is disproportionately impacting Black people, where asthma is disproportionately impacting Black people, where they have shut down schools in the city of Chicago, where they have still not done anything around the shootings that happen within the city, because we still don't really collect proper data around that. And seeing where those communities are disproportionately impacted, you will continuously see the same things over and over again. And the only way that we can really deal with that is if we deal with the holistic body of human beings, and also deal with the overall social determinants of health that Sister Ya talked about. We have to deal with the holistic human being and all the different factors that are impacting people, especially these different real social factors that impact our lives.
Max, I want to actually ask you a question. I noticed how you said you had the convening of the groups in Alabama and some of the other places. What's up with Chicago? When we gonna get our group?
So just update for Chicago. We did do a We the People town hall in Chicago right before actually the travel ban and everything people stopped traveling and everything at the beginning of March. But we are going to do a COVID response one later in June. That will be hosted from our Black Tribute Advocacy Network for everyone to engage. And we just pushed it back partly because we heard that because we had talked to Representative Peters, but we know that y'all are going back in, Illinois is going back into session next week. So that was going to mess with things. We'll be pushed back to a little bit later in June.
Very good. Sorry I missed the one earlier, but I know now you'll be letting me know about the one in June, and I definitely want to participate and be a part of that. And I also want to ask people and our listeners and callers, you all, we got to be like the Phoenix and rise. We can't keep doing the things that we same way we've been doing them. We might be psychopathically crazy in this country, as Dr. Bobby Wright would say, but we've got choices to make about should we keep spending our money on things that's not working for us. And if this healthcare system isn't working for us, and believe me, it ain't just about Medicaid or Medicare, but it is about coverage and medical services. And if it's not being serviced correctly where we're being healed, we do need to dismantle it. But I want the people who are watching this to start thinking about, should we dismantle our healthcare system?
That's an excellent point.
It is. And sometimes we know it takes push and pull through. There need to be some changes within the system while there's some movement from outside of the system to create our own. I just wanted to say to Sister Adrena about the question she raised. And again, I'm sure you know that we get updates every day from the city and the state. Every time some new information comes, there is a press conference and a status update. So again, when we are listening to the numbers that are reported, again, it is just for us to understand that they are painting another piece of the picture. So for example, the announcement now is there have been 28,200 Latinos who have been tested. And of them, 61% have tested positive. Okay, so then you say, wow, I wonder how many Black people have been tested now, and what is the positivity rate among them? So right now, you hear the number, and so then there is a press conference that says, okay, there's a rise in the Latino community. Well, you can ask yourself a couple of questions. One, is it because more Latinos have been tested, or that's why they're being more diagnosed? Two, what about other populations that could have or should have been tested? Do we have more tests going on now that are available in Black communities versus other communities so that people can get tested? And then the other thing is, are our people open to being tested? And especially we're going to talk about the next step in the link is about contact tracing. Yes. So we were going to talk about that. I know we're running out of time, but contact tracing is coming up so that what they're talking about doing is even having some of the children who are going to be part of this summer's One Chicago program, making phone calls to people who tested positive for COVID and asking them, where could you possibly have been where you contracted COVID, and then who were you around? And from there, are our people going to be susceptible and open to answering those kind of questions on the phone and give up that kind of data? And then because our people may not be as forthcoming as other populations, then does that mean that there are less of us who contracted, of less of us to talk about where we were and how we passed it, as opposed to other populations who may be ready to answer those questions? So it's those kinds of things that are relative to cultural competency in our communities that sometimes help us to miss out on opportunities or for numbers to be misreported.
I certainly want to just say something to that effect. You know, we're on this call to talk about equity and for our communities. We also have to talk about the equity of funding resources that come to our communities relative to COVID testing. We've got to ask the governor, our state reps, our state senators to allow community-based organizations that are familiar with our communities to receive and get contracts relative to contact tracing. We certainly have Black epidemiologists that we can consult with and contract with. It doesn't necessarily need to be all in the hands of the health department or a medical health clinic. We could, tax their organization could get money to do contact tracing. And so we need to be ever vigilant that we need money trickling or, given to our communities. And so we need to do that for not only COVID-19, but for HIV and AIDS. Okay, so we've got to keep those calls going. We have to tell our state senators and our representatives, if you cannot get an HIV test in your ward, then you need to call your state rep and your alderman and tell them that's unacceptable and we need money for testing. We need money for HIV testing and HIV care services, and we need money for COVID testing. And I know that is the end of our session. I want to really thank Sister Ya Simpson, and Max, who's a native Chicagoan, I believe. We miss you here in Chicago. Well, we miss you here in Chicago, and we appreciate you all. And Creola, my partner here, thank you so much for co-hosting this event with us, and certainly make sure that you all sign up for our newsletter so that you can stay informed and up to date. And Ya is also going to have this streamed on
CAN TV. CAN TV.
CAN TV. So it's going to be on multiple services. It's on Facebook Live, and it's going to be on CAN TV, and she's going to restream it. And so thank you all again so much for being on the call. I'm so sorry if we haven't been able to get to all of your questions, but please join us for the next town hall event. Look for that information coming soon.
Yes, remember every third Thursday, mark your calendar for the third Thursday of every month. We will be addressing some type of health equity, area of health equity. The next one we're going to talk about is housing. But just know this, over the course of the next 3 weeks, we're going to continue to follow up you with more information from Sister Ya, and from TAX, and from Black AIDS Institute, from Max, and from other organizations, as well as state officials and city officials about funding for HIV and AIDS. And again, remember, this is level up, because we need to stand up, step up, and speak up.
That's
when
right.
it comes to racial equity in our community.
We need to rise up.
And rise up. Absolutely. All right. Thank you all. Have a great evening.
You're
Thank
welcome.
you all so very much. Always happy to talk to
Thank you
Chicago.
to the fam. Shout out everybody, TRS, the whole lot, everybody.